Hello viewers, how do you approach a patient with vertigo or dizziness? Number 1. Vertigo is not a disease. It may be due to ear-related causes like benign paroxysmal positional vertigo, which is the most common cause of dizziness due to ear-related causes, or it can be due to labyrinthitis, vestibular neuronitis, cholesteatoma and its complications, Meniere's disease, superior semicircular canal dehiscence, vestibular schwannoma, just to name a few. Dizziness can also be due to non-ear related causes like anxiety, sleep deprivation, eye problems, joint disorders, or heart disease. A good history can often point the clinician in the right direction. In this video, we will discuss some questions that you, as a doctor, should ask a patient who is complaining of dizziness. Number 1. Start with an open-ended question like, please describe what you feel when you are feeling dizzy. Don't interrupt the patient. You get a lot of information from the patient when they describe what they feel when they are feeling dizzy. Follow this up with closed-ended questions like, are you always dizzy? How often are you dizzy? Please describe an episode of dizziness. How long does each episode last? Is there anything in particular that you can do to make yourself feel better? Is there anything in particular you have noticed that precipitates the episode of dizziness, such as head movement or loud noise? Then ask some specific questions related to ear symptoms. Do you have any hearing loss? Do you have any ringing sensation in your ear? Do you have any sense of ear fullness? Did you experience any ear discharge? Do you have any headache? Do you have any light flickering? Did you see any light flickering in front of your eyes before the episode of dizziness? Do you have fever? Do you experience severe headache? Were you ill with a flu-like illness just before the episode of dizziness? Do you have any chronic medical illnesses? Are you on any medications? Are you allergic to any medications? Did you have any recent trauma to your head? Do you have any history of ear surgeries? Does anyone in your family also complain of dizziness? Ask a few personal questions. Do you smoke? Do you drink alcohol? What do you do for work? Does this dizziness interfere with your work? Do you have a valid driving license? Why should you ask about valid driving license? Please mention it in the comment section. Now let's ask ourselves a few questions. Can we rule out or rule in some common causes of dizziness just on the basis of duration of each episode of dizziness? If dizziness lasts for hours following an episode of viral illness and it is not associated with hearing loss, can we think it is probably due to vestibular neuronitis? Just knowing what questions to ask is not enough. You should be able to analyze the answers. You should practice utilizing these questions whenever you encounter a patient with dizziness, and in my humble opinion, most of the provisional diagnosis can be correctly made just on the basis of a carefully taken thorough history. In a future video, maybe we can discuss how to perform physical examination in a dizzy patient, but before we do that, ask yourself this question. Will you perform Dix-Hallpike's maneuver in a patient who is dizzy all the time? Answer this question in the comment section below if you can. Thank you for watching this video. Take care, bye bye, and please don't forget to be awesome.